to thank you very much for your work.
Chair now recognizes Representative Fry from South Carolina for 5 minutes.
Thank you, Mr. Chairman, for having this hearing. Dr. Gupta way over here on the bottom bench here, but thank you for being here today. Prior to my service in Congress, starting just this year, I was in the General Assembly of South Carolina, where I was the chairman of the South Carolina Opioid response team, so to speak. We did, it was a select committee that was tasked with listening to medical doctors, law enforcement, teachers, people in long-term recovery, grieving families, and all types of professionals on how we can get a hold of this. And, you know, we borrowed a lot of our strategies from what other states were doing. We did some of our own that other states borrowed. That's kind of the beauty of the labyrinth of democracy, if you will, in our federal system. And I think that there were some pretty healthy policy initiatives that were passed into law, that were signed into law. But unfortunately, we've seen those numbers continue to climb, with fentanyl coming into our country through ports of entry, through between the ports of entry, through really everywhere. I mean, for a while there, you could almost FedEx it in. So, you know, this is certainly important to me because I've talked with a lot of families. I think everybody here has. I've talked with families just last week. We had a county councilwoman whose son died of a fentanyl overdose. And so you think about the stories and the human capital and casualty associated with them, and you really want to fix it, not only from the prevention side, which is where it's probably most effective, but from the substance abuse and treatment side too, and try to get these folks back. So, you know, during President Trump's tenure in 2018, they passed the Support Act related to ONDCP. In your mind, what improvements were made because of that 2018 law coming or being signed into law?
Thank you, Congressman. I testified during that time for this passage as a commissioner of West Virginia Health. I think a lot of work has been done to hold our agency more accountable and transparent in terms of data, dashboards, and really having the plans to be able to get done the work of the American people. And coordinating the 19 drug budget control agencies with a drug budget control budget. So the value of this agency in the mind of Congress, but also in the mind of American people, is actually being able to bring all the agencies together to fight this scourge, the challenge that has both addiction on one hand as a disease and the trafficking on the other hand as a profit. So this Support Act has been critical and central, pivotal to making the improvements. Numbers don't always reflect it, but we've gone through a pandemic at the same time. So we're in tough times right now in so many ways, but we are making consistent progress every single day in terms of those people. And I've treated so many people, hundreds, if not thousands of people with addiction myself, and seen some of them die in my hands.
Right, and thank you, for sharing that. And I think this was a big step forward. What in your mind, related to the Support Act moving forward, deserves an examination or improvement, since we're going to be examining this coming up shortly?
Well, certainly we think that there's a lot of things in terms of emerging threats like xylazine that we could improve on, how to get us there. This first time we did that, declared it to save more lives. We could do better on that. The coordination, there's some aspect of having better use of taxpayer money and what positions are needed prescriptively or not in order to get the job done. And then there's obviously data and dashboard. I think we've had some questions today that the data could be very helpful if we were to keep that data with us to be able to answer those questions.
Doctor, I think there was a Carnegie Mellon, and I'm going on memory, but there was a Carnegie Mellon study several years ago that said for every $1 that you invest in prevention, you save either, and I'm going to probably inverse these, but either $4 in medical costs and $7 in criminal justice. It's one of the two, but for every $1 that you invest in prevention, that you save that on the back end. The Support Act in 2018 allowed for some HIDTA funds to be used or allocated for prevention and treatment of drug abuse. What percentage was allowed?
I want to say it was 10. Well, we can get you the numbers exactly, but for HIDTA, it's the best return on investment, $83 for every dollar invested. and the prevention of HIDA, as well as other departments, education, health, and others. It is so critical at this time right now to invest more in prevention, especially for our youth.
Doctor, and what types of prevention and treatment programs does that fund? Just curious.
It funds partnership with our other program called Drug-Free Communities Program, which is focused on youth prevention across all communities, 50 states, 750 programs almost, and it helps prevent youth, both initiation of drug use, but also delaying in drug use sometimes as well.
Thank you, Doctor. Mr. Chairman, I'll yield back.
Gentleman yields back. Chair recognizes Representative Ocasio-Cortez from New York.